And new numbers from the Centers for Disease Control show monkeypox case counts are rising throughout the country.
Ohio's no different. Right now, there are 68 positive cases in the state, 18 confirmed right here in Cleveland. And while that number may not seem very high, health officials are concerned that a virus relatively hard to transmit is spreading this quickly.
News 5's Jesse Schultz spoke with local health officials who are stressing precaution, not panic.
Case counts rising, health professionals on alert. It sounds familiar, right?
Which included wearing masks, social distancing, frequent hand washing, right? Cleaning high-touch surfaces. Those are bona fide prevention methods for any type of communicable disease, monkeypox included.
But the monkeypox outbreak is very different from the initial COVID-19 outbreak.
It's a very difficult infection to spread. We already have a vaccine that is very effective. We actually already even have therapeutics that are known to be effective.
So monkeypox cases on the rise in Northeast Ohio is concerning to infectious disease specialist with University Hospitals, Dr. Amy Edwards.
This should be containable, and it is still a small outbreak, relatively speaking. But I'm concerned because it's gotten bigger than it should have gotten.
In the last week, 5,000 vaccines were shipped to Ohio. The Cuyahoga County Board of Health received about 1,200 of those.
The vast majority of those doses are being distributed to our major hospital systems, and then a couple of providers that specialize in treating members of the LGBTQ population.
But Dr. Edwards thinks there should be more vaccines available.
I think it is a signal that our public health infrastructure is not as robust as it needs to be.
It's something Cleveland's public health department is working on. But for now, city officials say the vaccine is for those who are positive, who have been exposed, and who are in high-risk communities.
I think everybody should be aware of the situation. Everybody should be advocating loudly for more vaccines in our community.
But experts are now scrambling to get the message out to everyone that it is spread by close contact with someone exhibiting symptoms like lesions, a rash, fever, and that contact could even mean using the same towel as someone who has it.
Because the outbreak started primarily in men who have sex with men, there was a lot of fear around the idea that there would be stigma around it. It's not very clear if it spreads sexually, and I don't really think it matters because having sex with somebody requires close contact. And close contact is how it's spread.
Officials sounding the alarm to prevent more harm.
It doesn't mean we shouldn't be taking precautions.
Reporting in Cleveland, Jesse Schultz, News 5.